Hey guys, Dr. Rob here today, and I'm going to teach you how to tell if you have an iodine deficiency right from your own home that may be connected to a thyroid problem like hypothyroidism or a problem with obesity or being overweight or having difficulty losing weight. So iodine is so crucial in allowing your thyroid to function. Iodine is the mineral that your thyroid uses to make thyroid hormone. If you are deficient in iodine, you're not going to make thyroid hormone, which means you could have problems with fatigue. You can make it more difficult for you to lose weight. You could have problems with dry skin, weak nails, brittle hair, cravings for carbohydrates, sugars, and sourdough type bread. And you can have weight gain that's distributed all over your body. You can even have thinning of your hair and lose the outer 1/4 of your eyebrow. So iodine is key to allow the thyroid gland to do its job and make the hormones that it needs to make. But before we get started, if you are one of those people where you think, you might have a health problem, you might have a weight problem, maybe your problem is connected to a thyroid problem, I put a link up here to my free online weight loss and health evaluation. That's a great tool that helps us get a more comprehensive understanding of what's going on with your body. And it kind of points us in the direction of the underlying cause, like why do you have the problems that you have, right? And for those of you that don't know me, my name is Dr. Rob DeBeese. I've been in private practice for 22 years. My clinic and I have worked with over 20,000 patients and clients from 43 other US states and 23 countries. So we've been doing this a while. And today I'm coming to you live to show you how to test yourself for iodine deficiency that may be behind your hypothyroidism, your weight gain, and your potential thyroid symptoms like hair loss, dry skin, brittle nails, cravings for carbohydrates, so forth and so on. So this is basically how the test works. It's really easy. Iodine is absorbed through your skin. So you can absorb iodine through your skin very easily. And what you need is one of two things, either iodine swabs that look like this, which you can pick up at places like Walgreens and other pharmacies around, or you could simply just get a vial of iodine and a cotton ball. So any one of those will do. You just need iodine. Iodine is they usually tint it like an orange color. It usually is an orange color, like if you guys can see that right there. See, that's kind of, I'll step out of the way. See, that's kind of orangey, right? So you want to make sure that when you do this test that I'm going to show you, that you keep your clothes away from it until it's dry on your skin, because the iodine's actually going on your skin. And this is how you do it. Very, very easy to do. So you take the inside portion of your forearms, this would be palm up, and we're gonna have the amazing Caitlin here, who's gonna she is gonna dedicate or donate her body to science today, and we're gonna go ahead and actually do this on her. So, however, the way this is done is we have the arm here, and we paint a 2-inch patch. So 2 inches across, 2 inches down, about like kind of a square, it's gotta be square-like as you can make it, of iodine on the inner forearm. And then we let it dry, so you gotta let it dry, very important, before you roll your sleeves down or else it's gonna stain your clothes. And then you watch it over a 24-hour period. If in 24 hours from the time you paint it, you notice it's faded, you probably have a mild to moderate iodine deficiency. If in 18 hours you notice that it's faded like this, you probably have a moderate to severe iodine deficiency. So the key is the time. 24 hours like this and it's faded, mild to moderate iodine deficiency. 18 hours and it's faded like this, moderate to severe iodine deficiency. Anything less than 18 hours, if it fades like this, like I had one patient, it faded, it was totally gone before she got out the door, massive iodine deficiency. And that could be easily confirmed if you wanted to do so. Through different testing. You could do urine test, that's 24-hour urine test, it's really easy to do. You can do blood work, there's hair tissue mineral analysis, there's different ways to test it. But that's not the point of today. The point of today is to teach you how you can do this at home for yourself, which is exactly what we're going to do. So, guys, I don't know if you're ready for this or not, but we're gonna have the amazing Caitlin on camera today, and I'm gonna actually clear out some space here, because this is live. Oh, and I just moved the whole thing, didn't I? Are we good?
Yeah, you're good.
We're good? Okay, cool. So let's have Caitlin in your arm. Caitlin, let's have come around. Oh, actually, no, come around. Which arm am I using? I'm using this one. Okay, cool. So we're using this one. So Caitlin, if you would hold your arm up just like this for the camera. Yay! Caitlin's arm. Perfect position. High five. High five. High five. Okay. So notice my square painting technique. So I'm using these because these are really easy to do. We're going to paint about a 2-inch square on her forearm. It's just like this. You guys can see this kind of coming out. This one's a little bit dry here. I don't know if you guys can see that on camera. Let's throw another one on there. These are kind of dry, aren't they? So I don't know how good you guys could see this on camera. Let's kind of bring it up right here. Kind of maybe hard to see in the camera. See if they can see that. Yeah, well, yeah, that's kind of hard to see in the camera. So it's darker from our end over here on the other side of the camera. But right here you can see I kind of painted sort of like a 2-inch square, 2-inch rectangle. Kicking stuff all over the place here. What she's going to do is she's going to let this dry. And she's going to make sure she does not have her clothes touching it, right, Caitlin?
No clothes.
No clothes touching it, because what will happen if your clothes touch it?
It will stain your clothes.
It will stain your clothes, guys. You don't want stained clothes. So she's going to be very cautious, and she's going to make sure her clothes do not touch this. Caitlin, round of applause for Caitlin, everybody. Yay! Thanks, Caitlin.
No
Caitlin,
problem.
can you make sure the camera looks good over there and people can actually see us?
Yep, you're
Good.
still good.
Okay, cool, good. So that's how you do an iodine patch test. Again, you're putting it on the arm, the iodine on the arm in a square, like this. You're letting it dry to make sure it doesn't damage your clothing. You're then watching it over the next 24 hours. If it fades in that 24-hour period, or a little after that 24-hour period, it's a mild to moderate iodine deficiency. If it fades in 18 hours, if you notice, like, wow, that's pretty faded in 18 hours, that's a moderate to severe. Now, if it fades earlier than that, if you notice like in 12 hours it's faded or 10 hours and faded, that's like a severe iodine deficiency, right? It's like kind of get to the health food store right now, get yourself some kelp, get yourself some bladderwrack, get infusions of iodine, do something. Go get some sushi, some seaweed, I don't know, but you definitely need some iodine. So I hope you found this information valuable. This is basically how to tell at home, how to do it yourself, and identify if you have an iodine deficiency that may be connected to your weight gain, your brittle hair or dry hair or loss of hair, your weak or brittle nails, your dry skin, your fatigue, your depression, your lethargy, and not feeling like doing anything. Iodine deficiencies can be connected to all of that because they are so vital in allowing the thyroid gland to make its thyroid hormone. Now, caution, point of caution. Now, this is very important for those of you guys that are with me right now. And for those of you guys that are on with me right now, if you guys could just do me a favor, put a little communication in the comment section. Let me know that you could hear me. I forgot to ask you guys to make sure that you could hear me. Got to make sure you guys are hearing me. I'm trying to give you great information. So if you could just make a little note there in the comment section that you got me, I'm coming in loud and clear, that would be great. So here's your point of caution. This is very, very important. So all ears up here right now, guys that are with me and listening, this is really important. If you have confirmed Hashimoto's thyroiditis, which is a thyroid autoimmune disease, do not do this test. Do not do this test on you. Iodine aggravates Hashimoto's thyroiditis. People that have Hashimoto's have an autoimmune disease where their immune system's actually attacking their thyroid gland. And there's completely different ways you handle that case versus a primary hypothyroid case or a person that just has iodine deficiency. If you add iodine to a person that has autoimmune Hashimoto's thyroiditis, you will worsen their condition almost 100% of the time. Iodine is usually not their friend. So if you know you have that, please do not do this test at home. And look, if you know you have any of these symptoms and you want some help, please go to the link. It's right up there. Click on the link, check out that page, learn more about holistic healthcare, learn more about holistic weight loss, learn more about how to help your body naturally, fill out that free online weight loss and health evaluation. We'll have someone reach out to you. We'll get you the information that you need so you can help your body and you can attain the goals that you want in your life. So I'm Dr. Rob. Thank you for being here today. I will catch you tomorrow at my next Facebook Live where we're going to talk about some really cool stuff tomorrow. Thanks, guys. See ya.